with this is I put it in the ultrasound as a driver. It drives it into the skin even better, so I'm getting the therapy of the ultrasound as well as the solution to break up scar tissue, decrease scar tissue, and increase the healing. What I do is I put a little bit of ultrasound gel on there. I poke a little hole in it to make a little nest. I put 4 drops of the solution in there, and I just stir it up with my finger so it doesn't mix, and then I put it on the ultrasound setting that's needed depending on the body part, and we push it in with the ultrasound. The ultrasound is used for driving all sorts of types of medications, and it's called phonophoresis. And the most often is dexamethasone that we use. But this is a much better alternative because it's not a pharmaceutical med. Not prescription, right? This kind of thing. You can see it doesn't really feel because now I have it mixed with gel. And as you start doing that, you can feel the gel start to get thicker. As that solvent starts to push in.
So by doing this, we're probably going to be looking at reduced inflammation in the area, to possibly break up the scar tissue.
Right, because the key about doing rehab is breaking up the scar tissue in that area. But one of the things you run into that is the balancing act is how much scar tissue can I break up without creating too much of an inflammatory response. So that's why usually after we do a deep trigger point, something with plantar fascia or something of this nature, I'll usually use biofreeze to cool it down or tell my patient to ice it, and that is really just to control the amount of scar tissue that comes back. Because when we start breaking up scar tissue, of course, that is a little bit of an inflammatory response, so we have to get this balancing act. Now, you know, what this product's doing is decreasing the inflammation after and during the therapy. So this would be more like my therapy session 6 or 7 into it. Because at that point you don't have as much inflammation and you're getting better therapy. This happens in 1 and 2 because it decreases the patient's response to the therapy, so they don't inflame as much.
That's impressive.
Yeah, with this driver it works really good. And then that allows me to do even more therapy in any set visit, which benefits the patient.
Inflammation,
right?
yeah. Okay, that makes sense.